available or may not be available. They may attend your call, they may not attend your call. But if it is a company, it cannot be like this, because a company is run by a director, and the director every year they have to give the solemnation in front of the Ministry of Corporate Affairs. So registration with Ministry of Corporate Affairs carries the highest value. First aspect. The second aspect, when you attend any kind of training program, see whether they are having any kind of international affiliations, like World Mental Health Organization, Complementary Therapist Association, affiliated associations, American Counselors Association. Okay, there are various organizations, and Ministry of Rural Affairs. Okay, under DDG GKY, they recognize the institutions which are conducting different training programs. And all these affiliations and recognition, it is not simply given. Each and every document will be verified. The company should have a PAN, the company should have a TAN. All these requirements are not required for MSME. The person who is running a company under MCA, they should have a PAN. The company should have a PAN. The company should have a TAN. So all these aspects available or not, that you can check it out. Then you can join. One more aspect as far as these registrations are concerned. See that the people who are conducting the training program, their organization is a trademark. For example, my company name is Emocare. It is a trademark. Now this name Emocare, nobody can use in the world. If anybody uses, I can sue them in the court of law and I can claim damage. Nobody can use it. But suppose if you are running a company for 10 years, okay, without a trademark, tomorrow I can claim trademark for that and I can run a training program. That means if somebody is conducting a training program without having any trademark, that company name has no validity. It has no validity. It has to be trademarked. Trademark means in front of the company name or will be there. So a company cannot be trademarked in a second. It requires minimum 12 months time. First, after registration, you are allowed to put TM, trademark, in front of your company name. Then after 1 year, the ministry gives you approval. When it gives approval, you can prefix on in front of your company name. So please see whether the company is trademarked, whether the company is having the real ISO certification. The real ISO certification is, see, ISO certification you can get it for 2,500 rupees, valid for 15 years. You can get it on the market very easily. And all those ISO certification has no value at all. But ISO certification, it costs from 2 to 2.5 lakhs. You will have to follow stringent measures, and every year it is being assessed. The assessment charge, every aspect the company has to bond. So such ISO certification carries value. So just check under which ISO the company is registered. So these are the very important aspects when you are undertaking a training program. More than this, try to understand about the trainer. See, there are two aspects. Somebody is preparing biryani, okay? Somebody is training how to make biryani, and he has read in a book and created a PPT and just training others how to make biryani. That is number A. Number B, he reads, okay, he prepares, he serves people, he is having experience, and he or she is coming and training you. With whom you will try to learn the things. Who can train you in an effective way? There are so many people today, immediately after PG, they start giving training how to do counseling or CBT or TA or whatever may be the aspects. People think that running the PPT is training. No. The simple aspect is, kindly see whether they have any experience in corporate. Ask them photos. Have you ever trained in any corporate company? Show me the photos of corporate company. Show me the photos where you have taken training in school. Show me a certificate where you have taken a training in manufacturing industry. Someone is conducting a training program on corporate counseling. The person has never conducted any training program in any kind of corporate sector, but they are training corporate counseling. Someone is conducting organizational counseling, and he or she doesn't have not worked in any organization. Now, how they will be able to conduct? The simple aspect is, they study in a book, create a PPT, and just promote, and there are people to join without understanding the merits of the organization and the merits of the trainer. Team, even if it is 1 rupee, it is a odd earned money. When you are spending it, see that the company in which you are taking training is having a legacy, and the trainer with whom you are getting trained is having a legacy, and they are having post training support. If they are not giving post training support, what is the use of training? Team, after 10 years from now, all this training will be vanished from the earth. Only online training. Online training also, there are many aspects are coming through artificial intelligence. Then the training, if you take with unknown people, or from the people who are not having even a company mail ID, will have no purpose, will not serve you effectively. For example, the first thing you have to check is whether they have a website, whether they have a email ID with the company name. For example, Emocare is having emocare@emocare.co.in, isn't it? Suppose you are going and telling, say, where are you working? Somebody says, what is your email ID? Shivakumar@gmail.com or Shivakumar@cts.in. Which one carries more value? The second one carries more value. So always try to learn from the company which is having official mail ID. If they are having only Gmail ID, it has no use, and that itself says that they are mediocre people. Just decide whether you want to train under a mediocre company just with the name, or mediocre people, or with great company. Hi team, thank you very much. Thank you very much for joining. It's 5 o'clock. So I'm very, very happy to meet you all. It's a wonderful evening. It is a wonderful evening with 100 people already over. Today we are going to see about the case history. Already we conducted the program on Sunday, and we got many enquiries. So we thought, okay, let us do a 2-day intensive program on case history. Case history is different, case study is different. And today there are many people, they don't know the difference between a case study and case history. Particularly college students, when they want to write a case history, what are the main aspects? People think that writing the name and their age and their sex, all these things are very, very important. That is what you call a list of aspects which you have to take. The important aspect in taking an history is the intervention part. The intervention part, wherein you will be writing, okay, this individual has come to me. When he comes, I do the MSM and I try to find out what is the issue. Writing the issue, what is that he suffers? Writing the issue, and after writing the issue, trying to find out what is causing the issue, and the intervention. What is the intervention? What is the intervention you suggest, and that is from which therapy? For example, is it CBT or REBT or motivational interviewing, what it is, which we have to give clearly and say it. So case history, it's a very a difficult area, because you will be able to write about the case history only when you know about the what you call the therapy styles. Without knowing the therapy styles, we will not be able to give any interventions. But today, I have seen that people are just like that. They just copy it from net and we just try to write. So we thought that let us train our people on how to write a case history. So thank you very much, team, for joining. So quickly, what we will do is, before I hand over the stage to Rati ma'am, I'm just having a poll. Okay, just answer the poll. I'm launching the poll. The poll is launched. The poll is on your screen. Kindly answer it. Team, I have launched the poll. The poll is having 5 questions. Okay. Two people completed. So team, this program is being simultaneously broadcast in LinkedIn. LinkedIn live, everybody will not be getting. Everybody will not do the LinkedIn live. I do not know how many of you know that live is possible in LinkedIn. Live is very much possible in LinkedIn, and it is being given only to the established and famous companies. And Emocare is the only company in mental health area to have that aspect. So this program, training program, it is being simultaneously telecast in LinkedIn, the Facebook page, and the YouTube page. In all these 3 aspects, the program is simultaneously broadcast. So 20 people have answered. Others, please answer, team. Team, come on, quick. 27 people have answered. 29. That's great. That's great. 33, 34. So it's very nice to see various people from all walks of life. From Kashmir to Kanyakumari, we are having people. That is very great. And if you are a college student, kindly share the link to your friends. If you are from Tamil Nadu, நல்ல விஷயத்தை 4 பேருக்கு சொல்லணும் இல்லைங்களா? If you are from Hindi belt, अगर कुछ अच्छी चीज चलता है तो 4 लोग को उसके बारे में बताना है कि नहीं? So when something goes good, tell to the world so that they will also get benefited. The poll is going. Meanwhile, I will introduce today's dignitaries. One is Dr. Rati Chandana. Dr. Rati Chandana is a very famous leader coach. She has conducted many leadership seminars. She is having her own, she is an entrepreneur. She is having her own schools, chain of schools in different parts. She is very much a competent personality, both in life coach as well as psychology. So today, in the beginning, she will be taking the session on the introduction and all other aspects about the case history. Then I will be showing a real life case history. Okay, a real life case history wherein how the case history has been taken, and we are going to meet Miss Vanitha, Dr. Vanitha. So she is actually worked in hospitals. She worked in hospitals. Now she is working in a school. She will be talking about the real life aspects of taking the case history.
And tomorrow we will, Rati ma'am also will be continuing from where she left. And tomorrow we will be discussing about many more live case histories. If possible, we will be doing a live case history here. We are trying to do the same. We will be doing a live case study, case history, and we will be having a few more dignitaries tomorrow. So this is what our plan. So today, actually now we have reached the poll. The poll is reached 74 people, okay, out of 100. So just 3 more minutes. Team, please complete. Please complete. Please complete. Meanwhile, I will check who are the other people from Emocare present here. Whoever is from Emocare, kindly join on the video so that I will be able to introduce you to the people. And I am Sita Lakshmi Shivakumar for the people who have joined now. Okay. So Emocare is India's first chain of counseling centers. And at present, we are having counseling centers in India and also abroad. We are having it in Dubai, we are having it in Netherlands, we are having it in Sri Lanka, and we are having it in Pakistan. Now we are having many centers in India. The Bangalore center is being managed by Dr. Rati Chandana and Sumitra. Mysore center is being handled by Sabina, and Delhi center is being maintained run by Banita, and Faridabad Ijaz Ahmad, and Calcutta by Fatma Varshia, Salem by Swati. Then we have Shilpa from Delhi, and Vinita. So these are the various people who are heading various counseling centers, Emocare counseling centers across India. And even you can join us in the journey. You can take a franchise of Emocare. If at all anybody likes to take the franchise of Emocare, you can get in touch with me. Now let me see how many people have answered. Yeah. Okay, 80 people have answered, and I am ending the poll. And the result is in front of you. I am sharing the result to all of you. I have shared the result to all of you. Okay. So the question is a case history and case study is one and the same. It is false. Actually, both are completely different aspects. So which are key to answer taking? All of the above is the correct. Rapport, right questions, and trust. All the three is required. And which are the ways to establish connect with the client? Okay. Introduce yourself. Address client by name. Avoid technical jargons, and all of the above. All of the above is the correct answer. The next question is which are the some elements of the comprehensive history? Caller information, first impression in the environment, identifying data. So all of the above. So all of the above is the correct answer. Okay, all of the above is the correct answer. The fifth one. The fifth one is actually the toughest question in the 5. The first 4 questions, it is very normal questions. The fifth question, which are the important elements of the comprehensive history? Okay. The important element. When I say the very important, important element. The topmost important element is name. When you have name and the past medical history, only just by knowing the past medical history, we will not be able to proceed in the history. First of all, we should know the name of the person. Then only what is the name of the person and what is the past history. Okay. So name is the answer, and thank you very much, team. You can post all your queries to us. Now I will. I've just stopped the chat box. Dr. Rati ma'am will be sharing her Instagram profile as well as the other profiles. Once again, I'm very happy to welcome Rati Chandana. After Rati Chandana, I'll be doing a live session, and Vanita ma'am will be doing a a discussion on the real-time aspects of case history. Now over to Dr. Ratichandra. Dr. Ratichandra ma'am, welcome ma'am. Ma'am, 1 minute ma'am. I will, yeah. Yes ma'am, I'm made you co-host.
Yeah, thank you so much. A very good evening to everyone, to our family of, welcome all of you to our family of Emocare. Thanks for sparing your valuable time for this valuable topic, what we are taking. This is the basics and which is a must. I welcome all our friends from our country, India, and our neighboring countries. This is such a grateful moment for Emocare, for the family of Emocare, that we have our guests who want to listen to us from all across the world. Thank you so much. And I hope we would be able to make this session a fruitful. It would be a valuable time for all of you. And thanks a lot once again. I would request all of you to please spare your time to follow us, Emocare, at Instagram and LinkedIn, so that you can be updated of what we come up in the future. And definitely, I would also add up my own personal Instagram handle too, and LinkedIn, so that you can be a part of it. So, okay. So you can share for Emocare too, no?
Yeah. That I'll share.
Yes.
You can continue ma'am. Yeah.
Sure. So I have shared my Instagram, and I would love you to just follow me on my LinkedIn Live too. So we're all here for you. And today we're going to discuss about your client history, case history, what we say. Why a client, a person would tell you about themselves? A very good question. Why would they like to tell you? Am I audible, please? Just give me.
Audible.
Yes. Thank you so much. Thanks a lot. See, have you ever realized that why would someone tell you about themselves? The case history is the past. What we all face today is the trauma of the past, from where we feel we are not satisfied. We are in stress because of what? Because of our past. Worries of our past. Anxiety is coming from the past. Did you ever realize why people would tell you about who are you? You have, the very first thing is you have to develop, generate the trust, the belief system with your client. Then only they'll tell you. Have you ever realized if you talk to a child also, sometimes even the kids never feel like telling anything. Sometimes there might be certain teachers out here, if they might be having some kids at school who might feel uncomfortable in the class, and they've got pain in the stomach also, but they don't feel like telling unless and until they have a satisfaction in their mind that yes, this person is trustworthy. Then and only then they'll come out with their pains, whether it is in the stomach, or whether they want to go to the loo, or whether they have something here and there of somebody has told. This is the same thing when a client comes to you. He or she is just like a child. You have to treat the person like a child. Empathy. And what questions you'll ask, and how you'll develop the case history, so that anybody, any seniors, if you're going through your internships, if you're going through your report generations, if you're at your initial stages of psychology or into this field, any senior of yours just picks your case history, they'll be able to understand what is the problem, the root cause of the client. Have you ever realized what would be the benefits even for us also? If the same kind of a client is coming up in the future, we'll be able to know that how to deal, because we have already gone, because human brain forgets very easily. We tend to forget the things. But if we have already jotted down certain things, made a relevant document of it, maybe nowadays we have got digital documents, and earlier till date, maximum, most of us are using the paper document. It works. We come to know. If the client is coming to us maybe after 2 years, you'll be able to know the history of the client. Earlier, this thing was only applicable in one kind of a medicine, that was homeopathy. Homeopathy treatment is such which takes up all the causes, your belief system, your nature, then they just do here and there and they come out with a medicine. Same way, we psychologists have to prepare the case history, and it is the need for us to move further with our client. We'll be definitely sharing with you the performer. I'll be talking further. We'll be definitely sharing with you the performer, how you have to fill, how you have to move with the client. The case history, we take up all the details of the client in the case history. Why do we take the details of the clients? What is the need of this case history? You know why? Because we get to know the overview. What is the problem? We get to know the overview of the client. Then we get to know the challenges. What challenges is the client facing? What challenges is faced by the client? Then we are able to give the solution. Unless I don't know the challenge faced by my client or even by my car, how would be I able to give the solution? And then is the outcome, whether my solution is working or not. If not, then again I can go and get into the client history details and I can change what is to be required, what is to be done. So moving on to this, we'll go in the depth, what all things are required. First, I'll show you the PPTs. I'll go, just try and understand, make up your mind. We take the basic statistical data of a client. We take the basic statistical data. That means the client name, age, sex, education, family, that's all. Then is the client history. History, what is the history? Kahan se aaya? From where it is coming? Investigations, we ask certain questions related to investigations. I'll give you the list of questions to be asked. Investigation, so that the outcome, what he has been taken in the past, what was the outcome? Past history, past medical history, maybe physiologically, maybe emotionally, mental history, maybe the client has come from someone else. He's already been into some medicines before, medications, maybe related to physiological factor or maybe related to the psychological factors. What were the outcomes of that? The history of the illness, the history of the complaints, the reference. We have to look into certain factors. Then only we'll be able to conclude and give away the solution. I would like to share my screen. I hope you would be... A moment. Is my screen visible to all?
Yes, ma'am.
Yes, thank you. See, this is, we are... Yes. This is, we are telling you about the case history, how we do it, and this is just the recommendations, what we are giving it to you. Can I ask someone not to do this, please? I have to. Thank you. Otherwise, we need to move on the rights further. See, try and understand the person, the client. The case is the real life. The real life situation. If I'm coming with stress to you, if I'm coming with depression to you, or if I'm coming with certain pains, that is my real life situation. And the case study is the analysis of that situation. If you have taken my case in a wrong way, if the analysis is wrong, then who would be the sufferer? I would be the sufferer. So take it very seriously that you are dealing with the real life situation, and your analysis is the only analysis which would be able to give the solution to the person. The successful case study analysis, a real life situation where existing problems need to be solved. What are you doing? What is my problem? You are analyzing, and then you are providing me with a solution. I'm coming to you that I have got a pain in my stomach, for an example. If you identify that what is the cause of my pain in my stomach, maybe it is because of the gut problem, maybe because of the liver problem, maybe because of the kidney malfunctioning, whatever. If your diagnosis, if your analysis is perfect, then only the proper solution would be given to me and I would be treated well. So when your case studies taking the case history has to be very, very definite. You have to be very much confident in that, what you all do. Identify the problems. Now, this is all what you are doing. Identify the problems, select the major problems in the case. What is the major problem? Suggest solution. This is just a briefing I'm giving. Just take it. Suggest solutions to these major problems. You have to identify major problems, then has to be selected, then solutions have to be given. Recommend the best solution to be implemented. What solutions do you recommend? And detail how this solution should be implemented, how it has to be done, how the medicine or how the treatment has to be taken care of. Now, how about the findings? Can you please stop someone, please, who's doing, or else I have to stop all the activities over here.
Chandana.
Sir, can I just, yes, sir.
Yeah, Chandana, I think I am also not able to find out who is it. Let us
No
continue.
issues.
I will try to check.
No issues, sir. No issues.
Somebody is trying to.
No issues, sir. No issues. We are open for everything and we are ready for that.
Yeah.
Findings. See, looking at the findings, the reader should be able to get a clear picture of the essential contents of the study. Suppose you are taking the case history and your senior is looking into. The person who reads the report should be able to get a clear picture of the essential contents. What has taken? Nothing should be left out, and whatever you have written, that should be clear. Identify the problems found in the case. You have to give your analysis, what you have found out. Suppose if it's a pain in the stomach, for an example, I'm not telling you about psychology here, I'm talking about any normal disorder so that you can understand it well. A practical example. So as per your analysis, what do you feel? Is it a enlargement of the liver? Is it kidney, or is it related to intestine or gut? Whatever. So that is your analysis. Then each analysis of a problem should be supported by facts. If you are saying this is because of the enlargement of the liver or something, what is the fact? Given in the case together with the relevant theory and course concepts. Whatever you write in your findings, you have to give the proof as per your study. Summarize the major problems. What is the major problems? You have to give the summary also at last. Identify alternative solution. If someone is on CBT, you might give an alternative solution. Briefly outline each alternative solution and then evaluate. What would be the pros and cons? Suppose if today the client is on CBT, if you recommend some other therapy, what would be the pros and cons and why do you recommend it? Your recommendations, your discussions. Recommendations and implementation, some of the main points, as I told, choose which of the alternative solutions should be adopted. If you suggest any other, if you're not suggesting CBT, if you're saying let's move on to REBT, why? Briefly justify your choice, explaining how it will solve the major problem. If you're writing in your summary, in your recommendations, then you have to justify that how this treatment would be beneficial. Explain what should be done by whom and when, how it has to be implemented. Now let's come to psychiatric case history, presenting the complaint. Basic things, we'll be sharing the performer, patient's name, age, sex, as I told you, demographic information, where is the person staying, all his locations, his house, brother, sister, father, everything, reason for referral, and by whom. Is he coming to you for with referrals, and by whom the person is coming. I have to stop the history of presenting complaint. This is an account of the patient's history on their own words. Now, here you have to understand one thing. Whatever history you are taking from your client, it is by his own words. A person is coming to a psychiatrist or a person is coming to a psychologist. That means the person is not in the good mental condition. So your analysis does matter. Maybe the patient is telling something, but the patient is telling with his own state of mind. So you have to analyze. Explore thoroughly what they presented with. For example, low mood, hearing voices. Usually what happens when you give them a performer to write, or when, see there, how do you collect the information? Either you interview them or you give them a performer to write, or you combine both. Okay. Initially, when a client is coming, they doesn't feel comfortable in talking to you about small things. They don't feel like. Maybe if you give them a performer initially, a small performer, we should never ever give them large performers initially in the first go. No. The information has to be taken in steps. The in-depth information. You have to create your rapport with the client. So just analyze later on which words the client has used. Low mood, how the client is speaking. You have to analyze the body language. You have to see, observe. Observation is one of the biggest skill of the psychologists. How do you observe? Explore for other symptoms, mood, psychosis, anxiety. If while writing, the client is having anxiety, is the client feeling exhausted? If the client getting irritated, just analyze. Always think about risk to health, safety, or welfare, to self or others. When you are dealing with the client, take it very seriously about your own health risk, about your own safety, and the others who are present along with you. Past medical and psychic history. How about this now? Past medical and psychic history. Can I request everyone to mute yourself, please? Thank you. Past medical and psychic history. Now, past medical could be any physiological problem, any physical problem, any significant past or current medical history. Maybe a lady, a person who's coming in stress, a female, she's feeling too much stress, but maybe she's a thyroid patient. Maybe she's a patient of PCOD. Maybe she's having a problem as she's not having a kid. Maybe she's having a stress due to some other physical disorders. So you need to have their past medical history and past psychic history too. Drugs. If any drugs she's been taking or he's been taking. Diagnosis. If she have been taking any medicine related to any disorder before, what was diagnosed? What was diagnosed? I have seen patients who have met with an accident, road accident, 2 years before or 5 years before, still they are in trauma. And I hope so many other psychologists here must have experienced the same. A lady who have been through the abortion might have stress. Though she's at a very good position with her job, she's earning well. She has a good financial status, but still she has a low emotional status. Why? Because she experienced an abortion 5 years before. So this helps you to come to know that what is the root cause. See, as a counselor, you need to understand the root cause, from where that problem is arising. Where is the seed popping up? Because we have to understand the seed to remove the seed. In counseling especially, try and understand from where the problem is coming. Whether she was referred to psychiatrist before, or when first referred to psychiatrist. If it is the first time she's meeting a psychologist or psychiatrist, or it's before also. Previous treatments if she's undergoing. Dates given, any dates given by the doctor where she has to visit the psychiatrist again and again, or a psychologist maybe once in 3 months, once in 6 months. And was it helpful or not? Previous hospital admission, whether she was hospitalized before any time or not. Because nowadays, every reputed hospital is having a psychologist. Every patient who is undergoing any surgery, or any physical treatments the person is getting, they are giving the time from the psychologists to come out of that trauma or of that pain, maybe for 5 or 10 minutes too, but still they are getting, because it is mandatory now for every hospital. So what was the patient's experience, the prior experience, whether she or he had been into any physical disorder or any mental disorder, need to be noted. Drug history. Is the patient going currently with any medication? What were the compliances, side effects, over-the-counter medication, or drug allergies? Need to know. If your patient says that, yes, I had been through an abortion, or I had been through PCOD, or I had been through thyroid, when was the last testing done? If she says or he says that 2 years back or 1 year back, ask them to please get it done immediately. Don't recommend any medication, any treatment, unless you get the reports, the current reports of the physical disorders, because you never know what is undergoing into the patient's body. Everything starts from here, it affects here. See, I tell you, we start, everything is there, with our mindset, whether it is good or bad. Our brain can rewire everything to treat any medical disorder, any physical disorder, any emotional disorder. Only we have to rewire and train our brain. So we need to understand, if my patient who has come with anxiety disorders or with depression disorders is actually undergoing any problem with the physically also. Till what extent this depression has affected the patient, or the physical disorder has affected the mind. So it is all correlated. So we need to understand. We should have the latest, the current medical reports. Family history. First, ask a broad question to establish if anyone in the patient's family has suffered from mental illness. Again, sometimes with the genes, chronically, this disorder comes. Maybe the mother was psychic and she passed away, whatever. So we have to check that whether from the family it is coming, it is inherited, or it is because of the current situation, maybe the environmental situation, or maybe any other situation. In cases of adoption or step parents, note information regarding biological and social family. Again, these questions, see, we'll be giving you the list of questions. Why these questions are asked? These are asked to go to the root cause. Everything is done. Nowadays, what is happening with the physical disorder also? You go for a stomach ache to a hospital, they'll do your ECG also. Why? Everything should be checked out. You never know from where it is coming. Same way here. To know the root cause of the mental disorder or the mental depression or the mental problem, go to every factor, which what you think could be. Go there everywhere. For all first degree relatives, mother, father, first degree means the very first connections, brother, sister, kids, or maybe the person might have got recently, the child might have, the person's child might have met with an accident or death, or parents or wife or sister. You need to know the cause of the death, history of mental illness, history of physical illness, occupation, quality of relationship with patient in childhood and thereafter. So all these things, sometimes it happens that the people feel guilt that my mother passed away because I could not reach to my hometown timely so that I could take my mother to the doctor. So they feel guilt that my mother passed away because of me. So note down the family history. This is the importance, the social history. Social economical factors are very important factors in nowadays, because everyone looks at what brand are you wearing and how you are living, which car are you using, your house, type of accommodation, your employment, your source of income, your money worries. Maybe a person is getting mental disorder because of the loans, the debts, or he has taken up so many loans from the banks, but now he's not able to clear away the EMIs because of the cut down in the salary in the jobs. Or maybe the business is not doing well, but he's not able to discuss with the family. But yes, he's inside getting into depression. So you need to understand. The person is doing smoking, alcohol consumption. If it is alcohol consumption, then till what extent? If it is smoking, then till what extent? Drugs. So what the person is dealing with, going through, all these factors have to be taken care of. History of personal history. Now, personal history, history of birth, trauma, place of birth. Place of birth, from where the person belongs to, where he had been taken, where he was born, now where does he lives and all. Family circumstances in childhood. How was the family? Whether they were rich, whether they were poor, or whether they were just sacrificing, or how was it? And whether it was a joint family, nuclear family, how was the environment? Because our environment, our education, all these things forms the belief system, which further forms our life. Early preschool childhood, if depending upon the age of the person, how does it matter?
Please mute your call, Steen. Please mute your call.
So preschool education, the childhood, I have muted. Preschool education, depending if this depends upon the age, what age the patient is, then you need to understand whether there was a problem. If it is a child or it's a teen, you need to understand whether there was a problem of bedwetting or temper tantrums in his childhood or till now, because I have even teenagers who have the problem of bedwetting. And it arises. Even sometimes, 5 years old also have got the problem of bedwetting, and 15 years also have got it. So you need to know this also. History of physical or sexual abuse, if they have been through. Primary school educational achievement, friends, trouble, what all things were there, whether they were enjoying their school or not, whether they had a good time at school or no. If a person in middle age says, I had a very bad time in my school, you'll get to know a lot of things from there. And if someone says, oh, my school life was superb, I enjoyed a lot, I had good friends, I used to do this, I used to bunk my class, I used to dance at my annual function, I had so many friends, I can't name one, my whole class was my friend. So you'll come to know. You'll come to know when you'll ask certain questions from your client, the way the client reacts. You'll come to know about. And if a person says, my school life was horrible, I went into a public school where I was always bullied by my friends because I could not afford the brand, I do this. So then also you'll be able to know that what is going through since childhood, from where it's coming. Secondary school, again, how was it? All education, right from preschooling till the end, higher education. Then qualifications, achievements, further education, employment history, chronological list of jobs, relationship with colleagues. Now again, in the job, if you ask, Are, how is your job? Do you have good friends out there? How do you chill out with your friends at least once a month? Oh, nahi yaar, I cannot do that because I have to go home and all my colleagues are jealous of me. Then again, you can do a better analysis, and you'll understand how the client is responding, reacting to your questions, how he's telling, or is he willing to tell or not. That too would also give you the detailed reports. Current employment, relationship, past and present, significant. These are all the personal things, the friendship. How many friends do you have? How often you go for traveling? How often you do this? How often you go to watch a movie with your wife? Or how often you go out with your friends? Or how often you go for dates? Do you have a girlfriend or do you have a boyfriend? All these personal things, personal history. You need to know the hobbies, the interest, religion. If a person says, I was a very good Kathak dancer. Oh, really? See, your main motive is to empower the client. So you have to see the place where you could pick up and you could know more about it. If the client says one answer, your questions depends upon your questions, what kind of questions you are asking to know more about it. Build your rapport, build your trust. Let the client have the belief in you. Trust is developed, then they'll answer each and everything. Forensic history. Few people forget to ask this. Past and pending charges, previous convictions, previous imprisonment, history of physical aggression, even if not charged. There are people who have this history. Though they were victim, sometimes, or they have done something or not. Still, and few of them you will get those who have done something wrong, have been imprisoned for some time, but now they want to come out of that trauma, but the society is not letting them to. So we need to help them to let that go. So you need to ask them. Sometimes it happens now in relationship cases, especially in dowry cases. Simply the boys are, taken behind the bars, though they have done, they are being charged even if they have not done anything. So need to understand. Pre-morbid personality. How do they react? Ask the patient to describe what they were like before they were ill. Oh, I was very good. I used to hang out, but now I don't feel like. I don't feel like talking to someone. I like my room. I like my mobile, or sometimes I don't want to. I've deleted my accounts, Insta account, Facebook accounts. You'll come to know how the client is taking all these problems. How would their friends describe them? Ask them. How would their friends describe? How would their relatives describe? How would their spouse or kids or whosoever they are being? How relationships? Is the patient shy or they love making friends easily? Is that relationship last for long or is it just superficial, upar se? Prevailing moods, generally cheerful or gloomy? Changes in mood. This you can always experiment when you are interviewing with your client. You can just say something about, crack a joke. Just see if they burst out to laugh or they just simply, just superficially, for you. So you'll come to know how they are. Empower them, ask their hobbies, ask their interest. And then you can always compliment them. When you compliment them, just see how, do they smile or do they give you a good, they react nicely, they respond nicely, or they love. Just ask them to tell some good, moment of their life and just see the excitement on their face. Then is how would they usually respond to stress? So you'll come to know how they're responding to the stress. Because sometimes I've seen people love and enjoy now, being into that stressful loneliness condition. They said it's okay. I don't want to dress up. I'm okay. So just see, are they enjoying this stress or actually they want to come out of it? You can help someone to find a solution if the person wants themselves. It is not when you pull, no. The person has to push themselves. The client, if the client actually wants, then only you will be able, a psychologist would be able to help them out. Mental state examination, appearance and behavior, speech rate, tone and volume. This you have to analyze when you're talking. Mood, high, low, thymic, reactive, flat, blunted, thought, content illusions. I'll just read and then I'll explain. Overvalued ideas, what is on the patient's mind, any thoughts of harming self or others, perception, hallucinations in any modality, attention, concentration, insight, does the patient think they are ill, have a mental illness, require treatment or require hospital treatment. Again, what is the current state of mind of the person? I'm not beautiful. I lost my boyfriend, he said that you're not beautiful. So I'm not beautiful. And maybe the person sometimes shouts, or maybe the person is at a lower voice. You have to see, you have to check the tonality. How's the mood? How do they behave? How are their thoughts? I'm good for nothing. This corona, I lost my parents. I lost my job. People are earning, but I'm good for nothing. I can't do anything. Hallucinations. Someone is coming. I feel someone is coming to take me also because I've lost my mother. And few people you'll see, they'll always say, no, I'm not well. I'm ill. My body is paining. My head is paining. I don't want to do this. I don't feel like sleeping at night. The whole day when you are on the bed, treating yourself as patient, do you think you will be able to sleep at night? They feel that they are patients. Now their life is as such. Even at the age of 30s, they feel like we are good for nothing. I've lost my baby. I've got abortion. I'm a patient. I cannot bear a child again. My husband doesn't love me. So what is their current mental state? But again, you need to understand whether they are looking for the solution or they require the hospital assistance or treatment or any kind of things. They have come to you for what? To find a solution. Or just they have been pulled by someone. Check this out. Prognosis. See, now comes, just make one thing, understand the psychiatric case history may seem long in comparison with other histories. It is actually a long thing because we are understanding their physical disorders, we are understanding their family, we try to understand so many things related to each and every part of the body, each and every mind, and how they have been through in their life. Suppose if I'm coming to you and I'm in 30s, so all my these 30 years, what all I remember, the case history is that. The student should try to empathize, that is, feel oneself into. Whenever you are taking the case history, just try, keep yourself into that place and try feel oneself into that. The patient's internal experience, what is going through in the patient's mind internally. Sometimes it is better to complete a case history over several shorter sessions, as I told you before, rather than over one long. In one long, mentally disturbed patient would never feel like giving all the information. It should not be like they should just take that information booklet and put it on your head. Yeah, bas, enough. So don't make it that way. Give it a very comfortable environment and keep it over short intervals. Maybe in several meetings. Patients may struggle to answer questions for many reasons. For example, they may be responding to auditory hallucinations. Suppose you ask me about my love life. Maybe if I'm getting something in my mind, I won't be telling. Maybe I have been through, any sexual harassment. So I won't be able to tell because something is there. It will take time. So give time, which are far more compelling to the patient, that was a student or doctor is saying. They may have prosecutory delusions which cause them to be guarded or hostile, or they may be confused whether I should tell or not. Maybe that this person might bully me in future if I tell. It is important to try to formulate such difficulties as giving valuable information about a patient's mental state rather as a problem, because they don't give a good history. It is often helpful to get a collateral history from a friend or relative. It is always recommended take the history from a person, maybe one either of their friend, depending upon the situation of the client. Depending upon the problem they're coming. So never treat them, yes, they'll be telling now, then only I'll know. You should have patience to take the history and always refer to the person, depending upon their condition, to the other family member or friend to have more details, and then create your report. See, psychiatric systematic inquiry. Honestly telling, there is no such thing as a systematic inquiry in psychiatry. It can be useful to have a set of questions about mood, psychosis, and anxiety to explore the patient's symptoms. Kuch bhi. There is nothing fixed. We can have multiple performers, but you have to create your own USP for a particular. You should be flexible to customize for in your questions. Though you can follow Nimhan's questionnaire, though you can follow AD questionnaire, but you need to be flexible. As Sir Shiva sir always say, be flexible. You need to be flexible to know more. This depends upon your questions. What kind of questions do you ask? See, now mood disorders. Am I not overtaking the time? We'll have 5 minutes more, then we can continue the session tomorrow. Mood disorders. Suppose the person you feel is in depression. What further questions you can ask? How you have been feeling in yourself recently? Is your mood constantly low, or do you have good days as well? Now, just reading out these two questions, just compare. Suppose these questions, you ask yourself, keep yourself in that position. Ask yourself, have you ever been into this condition recently, or it's been so long? Monica D, please stop doing it because it's coming on the screen. A humble request not to do it. Yes, a moment. Is your mood constantly low? Do you feel low the whole day, the whole time, the whole week? Or do you feel you have certain good days as well? Or some good time? Maybe when you get up in the morning, you feel good. Maybe when you watch TV, you feel good. So you have to ask certain questions. Let the client think that I am as such, or I have a variation. When did this start? Kab se hua? Is there any reason you are feeling low? What is the reason? Ask the reason from themselves, then you make out. Does your mood vary throughout the day? Throughout the day, you have got variations. Sometimes I feel I am in anxiety. Sometimes I feel I'm okay. Sometimes I feel sleepy. Sometimes I feel irritated. How is it? Do you feel yourself tearful? Do you want to cry? When do you want to cry? What makes you cry? Does anything help lift your mood? Does anything make it worse? What irritates you? If someone is shouting, coming and shouting, or at home also, do you feel irritated, or you enjoy if someone is dancing on music? Because sometimes it happens, when you play music at home, someone is playing a loud music at home and the other person is enjoying. Maybe you will find a person who's feeling irritated. And at the same time, maybe you will find another person who is enjoying. So you have to analyze all these questions. Please take it on to yourself also and just check what answers do you get. Does anything, how's your sleep? Have you got any trouble getting off to sleep? How long do you lie awake for? Is your sleep disturbed throughout the night? Do you get up? Do you wake early in the morning? What time early? Do you get, or someone would say, I just sleep at 2 a.m. or I just get up at 3. After that, I'm unable to sleep. But what would be the reason? Maybe they have taken alcohol, or they have taken coffee or tea late at night. That's not letting them off to sleep. Because sometimes if they booze more also at night, you know, the people having these disorders, sometimes they booze daily, they drinks daily, they have drinks daily. What happens? They feel like quite often they need to get up to urinate. So maybe that is not letting them to sleep. So you need to understand what is the cause which is not letting them to sleep. It is actually the stress, or it is something else created by the person. Do you wake up early in the morning, or what time? What has your appetite been recently? What do you consume? We are what we eat. Have you taken heavy food? Have you taken fried food? Have you taken good food? What was your mood while eating? Was the food not good as per your mood, what you had? Are you not enjoying your food also nowadays? Have you had any weight loss? How much? Over what period of time? So these are certain questions. I'll just finish this depression one today, then we can continue further. What's your concentration been recently? Can you read a magazine or a book? Because when you'll come to know what are the attributes, do you watch TV? How often? Do you enjoy watching movie? Are you doing it now? Or can you do you read some book? Are you enjoying that? What is your concentration level? Are you good in taking your projects at office, or what? How are your energy levels? Do you feel tired all the time, or you're feeling okay? Or are you good at your work, but when you're alone, you're feeling down? Has there been any change in your interest in sex? Are you not enjoying your sexual life if they are married? Or you're enjoying it? Is there anyone you're enjoying doing at the moment? Have you lost interest in things you used to enjoy? Have you lost? Do you like shopping? Do you like traveling out? Do you like boozing? What you were doing, ask them what you were doing before. Do you like that or not? What changes do you see? Because what the person was enjoying earlier, if the person is not enjoying now, then we need to check why. Maybe because of the company with which the person is doing, or maybe because of the other factors. How's your self-esteem? Or maybe something physical disorder in my body is troubling. That is all. That could also be the factor. How's your self-esteem? Do you feel low? What is your opinion of yourself compared to other people? Do you feel jealous, or do you feel that you're not that beautiful, or you have not got the promotion in the office? These are certain things, you know, which we daily come across when patients come to us. Do you feel inferior or worthless? How are your confidence levels? Is there anything weighing on your mind? Do you have a sense of guilt about anything? Guilt kills you. You know, sometimes your logics kills you. Logic kills the magic of living. Because we feel logically, oh, I couldn't be there. I couldn't reach to my mom, so she passed away. Sometimes these logical things, what logics we made, that kills the magic of our life. So we need to, again, check this out. What do you look forward to? How do you feel about the future? Do you actually feel to come out of this? Do you actually want to enjoy your life as you were doing it before? Or you want to live in this guilt? What you are getting out of it? So these are all the things what we have to look into. We have got things further. I hope we are all, it's already 6. We can continue this further tomorrow. Is it fine, sir? Can we continue this tomorrow? Or because I can take up if there are any questions now.
Yeah. Yes, 1 minute.
Yes, sir.
1 minute. Yeah, what we will do is we will take some questions.
Yes.
We will take some questions. I will do the live aspects tomorrow.
The people who are there in the camera, can I get, if you understood, were the things clear? Thank you, Ishwani. Thank you, Prishkila.
Yes, ma'am. Yes, ma'am.
Thank you so much.
Thank you, ma'am.
Yes, ma'am.
Thank you so much, ma'am.
Yes, ma'am.
Thank you. Thank you. Yes, sir. Over to you.
Yes.
I can ask Vanita, ma'am, to join. I hope Vanita, ma'am, can join now. Yes, sir. Any questions, please?
Ma'am, these slides are available
Ji,
in
sir.
the mail ID, or
We will be
can
sharing
you
it.
provide
We'll share, sir. We'll share.
provide
We'll share, sir. We'll share. We'll share.
Thank you. Thank you.
We'll share. We'll share. You have any doubt? See, you are there in our WhatsApp group. If you're not there, we'll just put the number here. You can send a notification and we'll add you to our group. To this number, please send a message writing your name and place. So we'll add you to our community. And then you can always there and you can join us to have more learnings. Learning increases, when we share. So we learn
Ma'am,
from you. You
I
learn
am from
us.
Nepal. Ma'am, I am from Nepal.
Most welcome, most welcome. We are all human beings, no? So if we would be able to add something to your life, we would be happy and we would like to have something from you to add up to our lives.
I have one question, madam. Can I ask?
Sure, sir, sure.
The person who has undergone some medications, especially for depression or anxiety, and this kind of client comes, whether it is advisable to take them, the counseling services will work with him or her or no?
I'm sorry, your voice is breaking, sir. If a person is going through mental disorder.
Yeah,
Hello.
Person is going through mental disorder and he is under the medications for last 2-3 years for any depression, anxiety.
Yes.
So such kind of people come for the counseling. It is advisable to entertain them or
it is
not?
It is depending upon the condition. That's what I said. We need to understand what is their current condition and what they have been. Suppose since last 2 years, they were into severe disorder. Then you need to check what is your level and what they have been going through.
Always, Arshad,
Yes.
wherever you have the psychotic issues, no counselor will undertake the case without the permission of the psychiatrist. The psychiatrist will refer them for counseling. See, suppose, for example, few people, they have been referred to me by one psychiatrist in Chennai. He will write a letter, Shivakumar, I am taking treatment. He is under treatment. And these are the medicines which is being prescribed. I request you to kindly do counseling for him. He will be referring. Now, under his guidance, I will be doing. Psychiatrist is the top. Without his permission, see, any client who is coming to a psychologist, this is what I used to do, and this is what everybody has to do. Wherever people are taking medicines, okay, unless and until without the doctor's intervention, okay, no psychologist should start to counsel. That is not at all advisable. So he has to, suppose, for example, sometimes it so happens, they've taken tablets for 1 year, okay, and they stopped it. After 2 years, somebody told you go to psychologist. Okay. The first question I used to ask is, 1 year you didn't take the tablet. Is it through the advice of the doctor or you yourself has stopped? Sir, I have stopped myself. You better go to the doctor. You go to the doctor. If the doctor says go for counseling, get it in writing, we will do counseling. Otherwise, he will not be entertained for counseling.
Yes. But one thing is there, sir. One thing good part is the person has got the willingness, to be fine. So that means looking into his condition, talk to the doctor and then treat him. And then definitely you will get good results. But because if the person is already undergoing severe medication over the past 2 years, so never take up such risk because people are not telling the truth. This is a hardcore fact. People are not telling the truth. They are not giving their history easily. That's what I told. Don't take it in the first go because if they are not telling the truth, they would tend to forget the next time what they have told in the initial meetings. Then something new would come out to you.
Hello, ma'am.
Thank you. Thank you, sir.
Yes,
Thank you.
ma'am.
On the same lines, sometimes the patient might come directly to the psychologist. He's still probably taking the medication, but there is no referral letter from the psychiatrist. In that case, how is it handled?
Archana, see, all these aspects, okay, as a psychologist, we have to take our own learned decision. The learned decision is, suppose, for example, recently I had one client, okay, one client. The client was taking regular tablets for depression. She tried to commit suicide 2 times. Okay. Now what happened? I told her very clearly, please go to the doctor. First, please go to the doctor and ask the doctor, sir, shall I go for counseling? Get the letter from the counselor and a letter from the doctor. Then we will start it. She told, sir, I don't want to go to that doctor. That doctor, I don't want to go because he is charging me heavily. I told, then go to the government hospital. Then go to the government hospital. Go to any doctor, okay, show your and come back. Actually, even in my own area, okay, there are 5 clinics, 5 psychological clinics. One of my friend, he took her. Okay, he started giving counseling to her. Okay.
Hello, ma'am. I have also a question.
1 minute, I have not finished
1
it.
minute, please. Let's her finish.
After 3 days, okay, he tried to commit suicide. Now, who will be held responsible? See, the simple aspect is someone is taking medication for depression and anxiety. If they stop, that will trigger the suicidal thoughts. Just by counseling, that cannot be correct. That cannot be correct. They should undergo medication. So without the knowledge, without the permission of the psychiatrist, wherever either the patient is taking medications or under the supervision of the psychiatrist, it is better not to entertain, so that we will be protected. Psychiatrist, clinical psychologist, then psychologist. Even if it is a clinical psychologist, okay, a little bit they will be able to have some kind of word, because at least they will be able to suppose somebody is a clinical psychologist, a registered clinical psychologist. Okay, somebody is coming with these aspects, big scale they can give, and they can try to understand what is the level now. Okay, and they can take appropriate action. But a psychologist is not empowered to take even assessments. We are not authorized. So it is better to refer them to the doctor. Learned decision. The learned decision is someone is in a very great problem. You have to tell to the family, kindly take him immediately to the hospital. Kindly take him immediately. At least we have to tell them. When we are taking a risk, if the psychologist is taking a risk, see that we are taking a risk, a calculated risk. Because we should not get into trouble.
That's why we always say that one agreement has to be signed before taking up any person. The person would sign that, yes, I'm not having any disorder, because if something happens in future, at least you have got an undersigned letter from him or an agreement. That is always recommended.
That's but as Raji says, agreement has to be taken, and it is better to save our skins in matters related to the psychotic aspect, wherever people are taking tablets, because everybody who has joined here, you know very well that every drug prescribed for any psychotic illness, it has side effects. It has side effects, isn't it? Yes or no? And that has to be handled by them. So it is better to take a learned decision. Learned decision, seeing the severity of the aspect. Okay. Once I got a call at night 11:30. Sir, my son is trying to commit suicide. Please come. Only the psychiatrist they have to go, because already they told that he has tried to commit suicide 3 times. 3 times from morning, someone has tried to commit suicide 3 times. Okay, they have to go to a psychiatrist because definitely he needs medication. At least he has to sleep. No? The first aspect is he has to sleep. Before counseling, he should sleep at least for 8 to 10 hours. He has to sleep very nicely. After that, only all the counseling. Now, we cannot prescribe. Even a clinical psychologist cannot prescribe. Only a doctor can prescribe. Now they are calling me at 11:30. I cannot say no. Now, because they are little bit my known people also. So immediately I went to their home, but I have seen that they are going to the doctors. I have seen to that. I went, I discussed, I told, let us take him to a doctor. Immediately I myself went along with them. We went to a doctor. Actually, at that point of time, we were not able to go to a psychiatrist. So nearby a big hospital we went. There was an MBBS doctor. We told him this is a problem, sir, and he told, okay, Shilma, you can take him to the psychiatrist. For now, I am giving him sleeping pills. Yeah, MBBS doctor can give, but we cannot give now. So MBBS doctor prescribed him drugs, and we have put him into sleep for some time. The morning, he has been taken to psychiatrist. Then, on the advice of psychiatrist, along with the medicine, counseling was undertaken. Now the boy is very well. Now he is working in marine engineering. He is a marine engineer now. When he met, he told, sir, I have seen most of the places in the world. He was very happy. The thing is, it has been done in a methodical way, systematic way. It is not that I can.
Sir, this is here the analysis of this study history, the case history comes in, where you are able to analyze that where does the client stand, whether you should deal or not. Your questions, here comes no, this is the biggest example, the proof. See, you are only asking such question, which has given the importance of the case history. So how important is it to understand, to analyze your client before treating someone?
Yeah, hope Archana, we have answered your
Yes.
question, Archana.
Yes, sir. Yes, sir. Thank you very much.
Taking a learned decision, taking appropriate action. Even in Sushant case, Sushant committed suicide. The psychologist was taken to the police station. The psychologist was taken to the police station to see his credentials. So, if nothing goes wrong, okay, everything is working. If nothing goes wrong, everything is working. If something goes wrong, okay, everything will be a problem. There is one person in Tamil Nadu, Healer Bhaskar. His name is Healer Bhaskar. He used to heal people through Reiki. Okay, and he was doing so many aspects. He was arrested by police 2 times. He was arrested by police 2 times. He was behind the bars. So we have to at least we have to work within the realm of science, within the realm of ethics, which we are following in the aspect. So thank you very much, team. Hope you people have enjoyed, and we will share the aspects. Tomorrow we will see 2 aspects. I will show you what are the things we will see. Just I will show you once. Okay. So 1 minute, just I will show you. Then we will end the session. Okay. So tomorrow we will see. Okay, can anybody say what is claustrophobia? What is claustrophobia? What is it?
Fear of being in closed spaces.
Closed spaces.
Yes. So the client is having that. Okay. So how is that the case history? The complete case history we will see. Okay. And how the treatment plan, everything. Okay. The treatment, everything. Then we will see bipolar affective disorder. Okay. This also we will see. And apart from that, we have 2 more aspects. This is as ma'am was telling. We will try to see it practically. What is it? And if possible, we will try to do something there itself. Do I have Durga here? Durga, are you here? Durga, she is an intern who is doing internship with me. Okay. She prepared and helped me a lot in this case history. Durga, are you there? Durga? Okay. So thank you very much, team. Tomorrow we will meet. You will be getting the link. Thank you very much. Hope you all.
Thanks a lot. Thanks a lot. Bye-bye.
So what will be the timing of tomorrow's session?
Thank you.
Thank
you, sir.
Thank you, ma'am.
Excuse me, sir.
Moment,
We will
yes.
be having the session of our Vinita ma'am also. Vinita ma'am. Vinita ma'am?
She's not here. She's in
Actually, I
YouTube,
want to know
guess.
the timing of tomorrow's session.
Timing, what will be the comfortable timing for you? You people. Shall we have it from 4 to 5
Right.
or 5 to 6?
5 to 6, sir.
5 to 6?
Yes.
5 to 6, sir.
All of you, 5 to 6? 5 to 6? 5 to 6?
Yes, sir.
5 to 6.
15 to 20 minutes maybe going extra. Okay, because we are going to discuss the case studies in depth. Okay, so 5 to 6, is it okay for everyone?
Yes, sir.
Yes, sir.
College students,
Yes, sir.
bring your people. Okay, please welcome your students. May I know who is first for Emocare? Who has joined for Emocare? So this is the first meeting for me in Emocare. Anyone?
So this is the first.
You're on mute.
This is the first meeting for me in Emocare.
So Ishavani, thank you very much.
Sir,
Ishavani.
me
Thank you,
also.
sir.
Me also, it's the first meeting.
Thank you so much. How
Me
did you
too.
find?
It's
How
first
was your experience?
Ma'am, it was a wonderful, wonderful. Really, इतना information तो कहीं से नहीं मिला जितना आपने
Thank you
दिया
so
cases
much.
के जाने के लिए. Thank you so
Welcome
much.
to our
Tomorrow we will
family.
have,
Welcome to your family, everyone. See you all tomorrow
Tomorrow.
with practical case
Very
study.
clearly know whole information.
Thank you, ma'am.
Thank you.
Thank you
ma'am.
so much.
Thank you so much. Thank you, sir.
Stay
Bye-bye.
connected. Bye bye. Have a good
Bye.
time.
Ma'am.
Have a good